All right, thank you very much.
Thank you.
Good morning, everyone. Kristen McCarthy-Vahey, co-chair of Fairfield Cares Community Coalition. This morning, I'm convening a special meeting of the Leadership Committee to discuss the Drug-Free Communities Grant. So we have 3 items on the agenda: call the meeting to order, Drug-Free Communities Grant, and adjournment. And with that, I'm going to turn it over to you, Kathy. I will note I have to jump off at 10 for another meeting, but I know there's a lot to cover, and let's get started.
Yes. So does anybody else need to leave at 10?
Yes.
Okay, Wendy. So let's try to get this done by 10. Okay, so I'm hoping that everyone has had a chance to at least familiarize themselves with the NOFO, Notice of Funding Opportunity. And I sent out the attachments to everybody because I think it's just important that leadership has a full set of the document. The couple of basic questions that I guess I need clarification just before we kind of dive into, how we want to approach divvying up tasks would be, in reading over the NOFO, it talks about funding for municipalities. And I just need clarification because I know that the school district is part of the town, it's part of the town's budget, but it has its own DUNS number, it has its own SAMS number, which are 2 pieces of information that need to be registered as part of this grant application. So my question is, how do we identify the legal applicant for this application? Is it the town of Fairfield / school district, Fairfield School District, or that's
Let me, before we do that, I just want to say, just kind of keeping in mind that even though probably no one will ever watch this meeting, but just the using of acronyms. I was at a meeting yesterday with someone. I want to make sure that we're, spelling things out. So we have a notice of funding opportunity to apply for the Drug-Free Communities Grant, which is a 5-year grant through the federal government, the Substance Abuse Mental Health Services Administration.
It is through the Centers for Disease Control.
Now it's through, sorry, forgive me, exactly. So it's through the Center for Disease Control, used to be SAMHSA. And that's what we're discussing, is that notice of funding opportunity and the various addendums that come with that. So back to this conversation, Mr. Cummings, good morning.
Good morning, everyone. Sorry I was late. I with the wrong link. It's happened to me lately, a lot lately. And not just online, just personally.
Oh, I get it.
Thank you, Mike. Thank you so much, Mike, for joining us.
Oh, absolutely.
And you got here for the question most relevant to you.
Yes, so I started us off. I actually have an approach that I wanted to share, but my very first question, Mike, is as we've talked about, the school district being the applicant, if you will, but legally, it's the town of Fairfield that I believe needs to be identified as the legal applicant. Because for this, in the notice of funding requests, the eligible organizations, eligible recipients of this grant include municipalities, but they don't specify school districts, but knowing that school districts are part of municipalities, right? And the school has its own DUNS number and SAMS number. I just wasn't clear as to how we identify the legal recipient for this grant, because that does matter.
Okay.
And just to add on there, it doesn't list school systems as one of the potential applicants, but there are 2 sort of other categories of potential applicants. So I think, Mike, if you guys have, as a school district, have applied for grants before and have been listed as Fairfield Public Schools versus Town of Fairfield, I think we can do it under one of the other options.
Yeah, and we do. I mean, we receive grants, I can't say all the time, but we receive grants outside the federal and state funding streams at times. But just to, just to make sure that the town is aware, what I can do is email the town attorney, copy the first select woman on this, just so that they're aware of the conversation and we can get guidance
Okay,
after the meeting.
okay, that would be very helpful.
Yeah, and when I was in Milford, the Milford Public Schools was the recipient in a sense of the grant and worked with the with Milford Prevention. So I wasn't aware of how it was done, but it certainly can be done.
Yeah.
Okay,
And I think Trumble, it is the Trumble Public Schools versus
Right,
the
I
town.
was gonna say the same.
Right.
Mike, when you do that, will you copy Kathy and I on the correspondence?
Sure.
That way we're all on the
Right.
chain together.
great, thank you. Something else I just wanted to make everyone aware, and you all are invited. There is a webinar on March 25th from 3:30 to 5 o'clock. It's listed in the NOFO. That is, I'm assuming, is an informational webinar on the grant application specifically. And I would encourage any and all to feel free to participate. You are required to register in advance. I just registered yesterday. And that's on page 2 of the NOFO.
Kathy, before we move on from that, is there anyone who knows that they would be able to make it? Can we actually talk about that right now? I know that I am not able to attend.
What time was that, Kathy?
From 3:30 to 5. And it's the link is on page 2. The NOFO.
I can make that.
Oh, great. Thank you, Mike.
Kathy, do you want to just register everybody on this call that says they can make it?
You might have to register yourself because of email addresses.
Yeah, that may not, yes.
Okay. I can make it.
And Phil. Yeah, I think it would be best. Sometimes it's sensitive to, the computer that's actually sending it.
Okay.
Yeah. So thank you, Phil and Mike.
I might be able to be there. I'm checking something. I'm back and forth a lot these days between Brooklyn and here. So I will check and let you know.
Okay, I'll put a question mark there.
Kathy, did I share the correct funding opportunity notice, or is there something else? Because I just want to make sure that we're all looking at the same document. I might
That's not
be
the
looking-
one you just sent, is it? Because I couldn't.
No, what I just sent was, what I just sent everybody was the logic model template.
You know, I got that.
Yesterday, you got an obnoxious email from me that included like 11 attachments.
Yes, and I did look at them. Where's the sofa? That I don't
Here,
have.
this is.
I put a link, so that is the one I just put in the chat. Okay.
Okay.
Yeah.
So so the NOFO was sent out last week when we first got it.
Okay.
So it
Awesome.
was made available on Friday.
Thank you.
I can send it again. It has been revised. I don't know how it's been revised because I was on grants.gov yesterday and I noticed revision as of the 17th, which, and looking through it, it looks to me to be the exact same document.
Well, Kathy, I think when you and I talked about it on Monday, we had noticed a couple things that everyone else noticed, like where one place it said that the narrative was 20 pages and everywhere else it said it was 15. My guess is it's probably that, or the fact that in like 3 places they say you don't need to submit an LOI, and then one place they say you do.
Maybe
So-
they've cleaned it up. Yeah.
Probably
The
those
same
kind of
number of
things.
pages.
And Kathy, to Phil's point, I'm 90% certain I can't come. I will register in case something miraculously changes.
I just put the registration link in the chat, you guys, because it's a long link, so that way you don't have to type it.
Thank you.
Um,
And Riney, the link that you put in for the NOFA only brings you to a Google Drive that you have to have a password for. So I don't know if
And
that's
The the drive has all the attachments and everything that we have to upload eventually, but essentially there's one main document that's the actual RFA. And I think it has the name CDC RFA in it. Isn't that right, Kathy?
Well,
Emily, I'll share that with you.
I mean, it's not that the other stuff isn't relevant, but it's relevant upon time of submission, and for you guys to discuss the grant, the main thing would be what the actual RFA is.
Can I? Never mind, keep going.
When I try and click on the link, it's not clickable.
I'll try to upload it if I can get in there.
Yeah, I just had that same problem.
I
Are you
just
talking-
be able to do it.
so if you all have the RFA is a little shorter than NOFO. So the document is titled CDC-RFA-2102. And on page 2, I believe that is a hyperlink that will take you to registering for the webinar.
Yeah.
I was able to do it just now, Kathy.
Great, excellent.
At least one of us is technologically
Well,
intelligent.
again, I couldn't link in, so.
Well, nor I know.
Okay.
So, okay, so Mike is gonna check on the whole legalization. All right. Okay, I will do that, Emily. I'm also wondering too, is it good use of Emily's time? And I don't want to put anybody in an awkward situation. If Emily also attended that webinar as our evaluator and, person who is intimately engaged in developing this grant application. I mean, that would be, 2 hours or half of her time, paid time, but I'm inclined to think it would be worth it. How about others?
I would think it would be, because she's an integral part of the whole process going forward. I mean, if we get it, she's critical.
Yeah. And Emily, I'm not even sure you have the time available.
No, I do. And I appreciate that you are asking. I do, you said it was on 325 at 3:30.
Yes.
Yeah,
Until
3:30.
5, until 5.
Yeah.
Yeah,
I
until
I
can-
would be 100% supportive of that if the funding issues.
Yeah, and we can, at this meeting, Kathy, we can look back at where we are with the budget. I don't have a running idea of that, but I think any support I can give you on the front. I mean, you've got a strong team here, but I'm happy to lend my support
Well, thank you.
how I need to.
Appreciate that. Yeah, no, appreciate that one. Appreciate that very much, Emily. All righty. So just wanted to go over some key goals of this grant, because actually the work plan that we will be developing as our grant application needs to specifically address these 2 goals. The first goal is essentially to establish and strengthen collaboration within our community to prevent and reduce substance misuse. I'm somewhat surprised the CDC has abuse in there, since the language really ought to be misused among youth. And then the second goal is to reduce substance misuse among youth, and over time reduce substance misuse among adults by addressing risk and protective factors. Make sure everybody's clear. Those are the 2 goals that this grant will be addressing. Beneath each of those goals, then, we will have SMART objectives. That under the objectives, we will identify our strategies using those 7 strategies that SAMHSA and CADCA provide, which will also identify the activities for those strategies. And through that, each activity will identify the person responsible and the time frame. So that'll be the work of I think the data committee plus others. We had a very productive meeting the other day when the data committee met to focus on the logic model to address the alcohol and marijuana, which included a student resource officer, Giles, who was terrific in terms of providing his perspective and really took an interest. And so I'm hoping that he will stay involved. I'd also like to invite anyone from the package store, since we're addressing alcohol, underage drinking. I think it would be beneficial to have someone from the retail community to as well. So I think we're poised with having a good group of people to really focus on the guts of the work plan. I was hoping leadership would be willing to take on the attachments. And we have, this is all sort of, it's not, I don't want to call it busy work. You know, they all need to be part of the grant application, but there are all these little tasks that need to be done as part of the full application. I was hoping that maybe we could focus our attention on those attachments, if all right with everybody, or just other people have other thoughts or other questions that we want to address right now.
Hey, before you do, will you again read goal number 1, which I've heard a few times, but I just think it's worth repeating. I think the second one, to reduce misuse with youth and over time adults, is a little more straightforward, but the first goal, if you don't mind.
Yep, so this is directly from the RFA, goal number 1, establish and strengthen collaboration among communities, public and private nonprofit agencies, as well as federal, state, local, and tribal governments to support the efforts of community coalitions to prevent and reduce substance abuse among youth 18 and younger. That is the first goal. Which reiterates the significance and purpose of having a community coalition, right? It's everybody working toward common goals. We each keep our own identities, but we're all working together to reduce and prevent substance misuse in our community.
And Kathy, before I forget, I just want to let you know, and we haven't talked about this, but we did at least once, and I think twice, implement a collaboration survey where we assessed it. So we actually have some data on, you know, kind of we modified a standardized tool and assessed it, and we could do that again if we wanted to get a baseline of kind of, you know, there's 10 or so different areas in which we as a collaboration assess kind of, or as a coalition assess where we are and where we need to go. So in addition to making sure we have sector representation, there's a lot of different domains in which, you know, a quote unquote functioning collaboration is assessed on.
Yeah, that actually would not be a bad idea. I just wanted to read on page 14 of your NOFO. I think this is a good example of what would be considered an objective under that first goal. And it reads, because this is really all about collaboration and how different members of the coalition would work together. So public health staff will meet with key stakeholders at all high schools in our jurisdiction, resulting in 3 out of 4 high schools committing to work on educating about and implementing drug Dropbox programs by June 20th, 2022. So that's focused on the whole collaboration piece. And that's the sort of thing that we want to identify in our work plan, you know, that like the prevention initiative we did, for example, working with the stores in the community. And something that we also want to keep in mind is that activities want to be addressing individuals, families, and communities in terms of those, three legs of the stool, if you will, on how we're going to address behavior change eventually. So getting back to the attachments, well, this is just somewhat of an aside, but it is part of the application. I have asked Bernadette as our treasurer if she would be willing to take on the lovely task of identifying our match. And we need to come up with $125,000 match. We cannot use any state or federal funds from federal sources, but we have lots of in-kind, and the match will be predominantly in-kind. We just had a little fundraiser. We can include that in our match. And we have some help from other folks who have gone through this process already. Margaret can probably advise us from the Norwalk Partnership application. We've Trumbull's application that will be helpful. So it's not as if we need to start from scratch, but it would include professionals' time, for example, on our coalition. We have a lot of people who come in their work capacity to our coalition meeting. So we would use essentially their hourly rate times the coalition meeting, times the number of times they get together. So I think we can get to 125 easily. I hope I'm not naive in thinking that, but it can be done. If we were not all virtual, it would be a lot easier because we'd have things like, meeting space rental that's being donated, supplies being donated, things like that. But even so, that would be helpful. And so I guess I want to ask the team, is everybody okay with that on as a task? And I haven't heard no from Bernadette. But
and we will help her.
Yes.
And Kathy, just to be clear, you're asking her to take the lead. It doesn't mean she needs to do that all herself exactly.
Right.
Margaret's saying to help her.
Right.
But I think if she's willing to take the lead on that, that makes absolute sense.
Okay.
Which attachment would that be?
Well, that one's not an attachment.
Okay, it's not an attachment.
It's part of our budget.
Okay, now you answered the question.
Yeah. But looking at the attachments, and
You know what, Kathy, could I jump in for a sec? Because I'm wondering if we're jumping straight into the ask of people to do the attachments, but I wonder if we could just take a minute and get the rooms, because Kathy and I already had a meeting, I've talked through the grant and stuff, but the rest of you may have some comments you want to make on having reviewed the RFA. Were there things you expected, big questions you have before we get into identifying little sort of tasks? Any comments or questions overall about the grant?
The only thing I would be cautious about, Margaret, is that we're 30 minutes into a 60-minute meeting, and Kathy wants to have every attachment assigned to somebody in the next 30 minutes. So I think we have to be cautious that we don't lose track of time.
But this is also part of our ask today also is going to be, my suggestion was that we should set a time, like try to set either a weekly or bi-weekly time for leadership to get together while we're working on the grant and have that on the books. And sometimes we may be able to cancel, and sometimes it may be, 2 or 3 of us who are like, this document is going to be reviewed by these people, but this is not the one and only meeting, Phil. And I do think we asked everyone to read the grant through, and it's worth seeing if anyone has any overall comments. But you're right, not for 30 minutes, but just anyone.
So I'm going to make one comment. I do think we should schedule a meeting. It might need to be, I don't know if this works for Mr. Cummings, but like a little bit earlier in the day, which I know like pre things getting rolling. I don't know if that works for you, Mr. Cummings.
Yeah, earlier is usually better for me.
Yeah, I will definitely not be able to participate. We're heading into the craziest time. So I'm going to tell you, I have not reviewed this document yet. So one of the things that I will say about the process is, for me specifically, and this is maybe true for other members of the coalition who are going to ask for help outside of this group, the more specific and digestible we can be in terms of giving them a clear task, clearly articulated and defined with a deadline, I think will be helpful.
Most definitely. So if we could, I'd like to go through the attachments and sort of my ideas for who could do what. And I know not everyone is on this call. And I'm certainly flexible. We go through the next attachment. I'm just going to go this attachment by attachment. We have the coalition involvement agreements as our attachment 1. And
For my purposes, can you just go through the list as it is on the email?
well, I am essentially, Bill, the first 3 were just addendums or appendix that are just information, they're purposes, but the attachments
Okay, so those aren't assigned.
follow. So this
Yep,
would be
okay.
attachment 1. is
Yep,
Coalition involvement agreement.
Yep. I got you.
Okay, and this is where we identify our sector representative by organization and by individual, as well as identify the rationale for choosing that organization and individual. So obviously, and what the RFA is recommending, there'll be common language as far as what the expectations of the sector representative will provide and what the coalition will provide, but it should also be somewhat unique and specify, what we hope to glean from having this organization and this person be our sector representative. So we need 12 of these that need to be signed off by the official coalition representative. And I guess we need to identify who that's going to be, as well as the grant award recipient legal applicant.
Kathy, can I interrupt for a second? Is
Sure.
it your, let me ask this. Is it your goal to say each attachment has a point person who is responsible for leading that effort for each attachment?
Yes, and I've also grouped some of these attachments under one person as well.
And can I also ask, have you already thought through who might be best?
I have for most of them, but wanted to have a discussion about this one because it's a little bit more involved.
But I would rather just go through who do you think would be best? Go
Yeah.
through the list.
Okay, okay,
Because
okay, all right.
Give us
Well,
jobs to do.
since we're talking about this, because this is the one attachment that I wanted to have a little bit of discussion about. Yeah, I didn't know if I could draft the coalition involvement agreements and have them reviewed by leadership. Does that make sense? I guess I'm questioning process here. I can
Kathy.
certainly draft that, but yeah.
Kathy, the amendment has a sample in it. I can certainly pull out that sample and customize it for us, because I can do that fairly quickly. And then I can help with those parts of putting people, if we want to use that exact sample the way it is in the attachment, or if we wanted to change it. But since we don't have any existing ones that we have signed in the past, we just use the one that's the coalition involvement agreement that has been provided in option 2.
Yeah, there's, well, the actual language, let's see, it's in the attachment.
Right.
On on the 3rd page. So I think we'd want to stay as close to their language
So
possible.
Kathy, I think Riney just offered to take point lead on that. And Riney, I'm happy to support you with that. So if you want to bounce stuff off, I'm happy to work with you on that one.
Well, and the initial part is pulling out the sample, and they have it provided by every single one, and making sure that the coalition name is in there, and then obviously we need the name of the sector representatives, which I know Kathy has been working very hard on. So I know I will not have to be finding those sector representatives,
Oh,
but I will be able to, I will have to hound them to get them to sign.
Right, and we can work together, and there's only one. So let's, Kathy, just in the interest of time, it's 9:39. We have an answer for the first addendum. Let's move on
Great.
to the next
all right,
one.
let's move on. Then I'm just gonna go through, then the second addendum is the minutes, and was hoping Lenora could take that on just to find us a set of minutes that need to be from January 2020 forward to show that we have been in existence for at least 6 months. And it would be helpful to have a set of minutes that also show coalition member involvement. So that is something that I have, and I've not asked Lenora that, but that's just.
You just did.
Oh, there you
Lenora?
are.
Sorry, I came on late. I
Lenora,
apologize.
is that a yes?
Hey, Lenora.
Yeah,
thank
is
you.
in terms of set of minutes, is it more than one or is it a
No,
group of? It's just
It's
one that
A
looks
minimum
like,
of 6 months.
It's just one,
okay.
and
So are you willing to, I'm sorry, I'm going to be a little bit like I am at my committee meetings. Are
Yes,
you
I will
willing?
take,
Okay,
yes, I'll
great.
take that
Let's
on.
move on to attachment number 3.
okay, and
Where
this is the,
Can I just
Lenore?
ask, I've printed the document, but where are the attachments that you guys are looking at? Is within the document?
No,
no,
they're in.
Something-
Go
I
ahead.
received a second email yesterday from me was like 11 attachments to that email.
Oh, my goodness. Okay.
Yeah,
It came in yesterday at 11:02 a.m. That's what this is on. All right, let's move on to item
Move
number
on, sorry.
3.
okay.
I will look.
So a number of these attachments just need formatting and signatures. And I was hoping, Lenora, you might be willing just to take that on. That would include attachments 3, 6,
Okay.
7,
Uh-huh.
11. And attachment 5 is just a statement, just, that
Okay.
I think it's our zip code. I think that's what attachment 5 is.
Okay. I need to pull those up.
Well, there are 11 attachments in total, Kathy.
Yes.
Okay, so you're asking Lenora to look at 3, 6,
3,
7,
6.
and 11. Why don't we leave it there for now, even though,
Okay.
is there one other that I see? It's 5 is a letter that requires an actual letter,
5 is,
13, right?
well, no, this just simply says that if we don't have anybody overlapping with us, so we just simply state that. We would need a letter of mutual cooperation if there was another coalition working in Fairfield.
Gotcha.
So
Okay.
it's
So
just
that,
one sentence.
so were you hoping then to loop that one in? So it'd be 3, 5, 6, 7, and 11?
Yes.
How about I make this recommendation? Lenora, can you at least promise to review if you're unable to take those on?
I'll tell you right now, I do not have an 11 o'clock email from you yesterday, Kathy.
I'll forward it. Which email is it? I've got it
Okay.
up.
It's
The last
all
one
the
I got-
attachments.
Yeah, yesterday was at 8:45. So I apologize.
It went to your Gmail.
Lenora, which email do you want it to?
LP Campbell 1961 at Gmail.
Yep, it's
Yeah,
coming.
that's what I have.
Yeah,
All
but,
right, I just resent it. Hopefully you'll
okay,
get it.
thank you.
Okay.
Okay,
Okay.
but
And can
Okay.
I ask
Sometimes
Margaret
it
a
just gets
question?
lost.
go ahead, Phil.
Every once in a while, an organization will fill out a grant and put in a zip code. Are we sure that Positive Directions did not list Fairfield zip codes in their DFC grant?
Oh, no, we have 8 zip codes in Norwalk exclusively.
Okay, thank
Yeah.
you.
Okay, so Kathy, you're back. So if that covers, we've got 1, 2, 3, 5, 6, 7, 11. So now we need to go to 4 and then 8, 9, and 10.
So for Kristen, I was wondering if you might be able to take on, it's the MOU between the coalition and the town / school district.
Yep, I'll work with Mr. Cummings on that. I'm gonna volunteer. Obviously, we'd have to anyway, so.
Yeah.
Okay. That would be great. Bill, don't worry, I'm coming to you. I know you're eager.
I have to leave
I
the
know
meeting
you're
just before you
eager.
mention my name.
All right, Phil, attachment 8, the general applicant information would be so helpful if,
The answer is yes, move on.
Okay,
Okay.
great. Phil is doing, and we're making sure, I'm writing this down too, to make sure we have this in documentation. Of course,
Hey,
we
me
recorded
too.
this.
It's being
9,
recorded.
exactly. All right, 9.
9 is also a Phil request. And I will provide you with the project description, but if you could just format it and
Okay.
provide our congressional delegation information, that would be helpful.
Yep,
Just
Yes.
FYI, yeah, so we're letting them know we are applying. Is that what the notification is for the congressional one?
Yes.
Okay,
Yes,
all
and
right.
that and I think it's also, once we've been, that's also, they get notified that we've been, yes.
Okay, all right, gotcha.
believe.
Phil, we'll talk about that too.
yeah, you know, the purpose of this is so that when we do get the grant award, they can take credit for getting us the money.
That's fine, if they
I
can
don't
get us
care,
the
as long
money.
as we get it.
Exactly. I plan to be talking to that office too. Okay, 10.
And then 10, I thought I would do, since it's resumes, and I think it's, Doreen's resume, my resume, and I think that covers it. So that's not a big deal. So we can do that. I think for formatting purposes, I think we should all agree to work with the same font. And I would recommend Times Roman 12-point font. And everything needs to be a 1-inch margin, single spaced.
Okay, format, Times New Roman, 12-point,
Single space.
single space. Boy, I feel like I'm back in grad school. Ma'am, yes, ma'am. Woo.
You get your 1-inch margin.
Yeah, the 1-inch margin.
Right.
Right. Yes, so that is such a huge help, just to have all of those tasks.
Awesome.
What happened to 7? Oh, where's 7?
That's with Lenora.
7.
That's actually with, sorry, it's
Oh,
with
that's part of Lenora. Got it.
If Lenora, again,
I'm
so
sorry.
I'm just gonna review what we have. Let's make sure we are in agreement here. 1 is the coalition agreement, Riney, and I'm here to back you up in any way if you need it. 2 is 2, 3, 5, 6, 7, and 11 are Lenora, if she is able to take those on. Upon review, if Lenora is not able to, who can be the backup?
I can also help Lenora.
Okay,
Thank you, Phil.
So Lenora, you and I might want to just have a Zoom meeting, just the two of us, go through each of those numbers and see if they're so simple that it'll be 30 minutes of work for you, or whether we need to parse them out.
perfect. And
Okay.
then item number 4 is myself with Mr. Cummings. Item number 8, and items 8 and 9 are Phil. Item 10 is Kathy. How did I miss 11? No, Lenora. has
11's on,
11's
yeah.
Lenora.
Yeah.
Okay, so we have all assigned duties to all 11 attachments.
In
That
terms
is-
of formatting, Kathy, on attachment 8, they have the information required and then a very small box for the quote response. What is it the drug-free community's expectation that you'll use this as a format and you've got to give you a response in that box? Or are we talking about a narrative response? How are you assuming that each response will be formatted?
Well, all of this is going to be more detailed, so I think these are just short sentences. You want to provide the information, you want to, just state, like, put in the full mission statement, for example, and the first one, identify alcohol.
But are they expecting to use this format? And so whatever the response
Yes.
is fits in that box.
Yes, you want to use this format.
Okay.
Taking a picture.
And the question on mission, Mike, I think part of the answer will be if the applicant is the town
Yeah.
and the school district and Fairfield Cares, do we have to start with the town's mission, the school district's mission, and then the Fairfield
But Phil,
Cares?
Phil, it actually
No.
just says what's the coalition's mission statement.
Right.
Oh, okay, good.
And I think they do fit in the boxes easily because apart from the mission statement, in most cases, like number 2, it's going to say, alcohol, marijuana.
Yeah, okay, thank you.
Yeah.
I am wanting to just make a comment. I told you guys I just took a picture, and I know we're all business, and I'm really glad we now have, a game plan for all these attachments. I just have to say, I'm feeling emotional about this because we have been working towards this for 10 years. And I took a picture. I feel like we should submit that with a grant. Look at this group. Just to apply for this grant, let alone the coalition. I feel incredibly grateful and proud of everyone here, the kind of dedication that all of you have shown. I'm so corny. But
I would do over with my mouth closed. And
I
my
was gonna
eyes
say, what do we look like?
Yeah.
I know, I haven't
Cal.
showered yet.
I'm not putting it anywhere, but I'm hoping that we can look back. So what other jobs? I know, back to work, there's our little moment, but Kathy, for the other, for kind of the I guess I would say the meat of the grant, so to speak. That's the other part in terms of game plan. You talked earlier about, we have an SRO, we want to have we have someone from the package stores, but I also, this shouldn't all be on you either. So how does that work?
I mean, that's the beauty of the work, of the data committee and the work group. So I think my approach is to focus on this work plan first, and then kind of back up, and we can come up with the background. We can do the background and sort of some of these other, the project narrative. But I think once we know what we're going to do, then we can do these other things that are part of the grant. So I'm just focusing on the heart of that. And I do have some questions that would be appropriate for the CDC folks to answer, because there is some confusion when you read through the RFA. The work plan will refer to just 1 year, but then the project period is actually 5 years.
Yeah.
Through 5. And I have some question about then also, how do we discuss short-term, intermediate, and long-term outcomes? There is some confusion around, for me at least, how we infuse some of this other information, or are we just to focus on just that 1 year time frame? Lumped all my questions together.
I would say that the approach part is definitely where we are going to be talking about longer term stuff, but the work plan, that looked consistent with what everyone else has had to do in DFC, which is the work plan itself is for 1 year. And so just for those who haven't been involved, we've had these meetings to look at the logic models for alcohol and marijuana in the last couple of weeks that Kathy alluded to, and those have been really helpful. And I think what what we really need to do next is reconvene that group. And I think one thing we wanted to ask you all is if any of you want to join in some of those meetings so that we do come up with our approach, whether or not you guys, even if Kathy and I are sort of drafting things for your approval in terms of the technical, the narrative proposal, we want everyone's input at that point. And one thing that struck me in the RFP that I talked about with Kathy the other day, and she had noticed, is that they've actually included a whole section on primary prevention. They've mentioned primary prevention and mental health and suicide as underlying all the substance use stuff, which they do not normally do, right? And in our logic model discussions, we were, people were like, how do we build in the mental health part? And we're like, they don't want you to. It's like it's not part of the base of your logic model. It's like some strategy down the line. I think this has opened up some options for us. So I think the discussions with whoever here wants to join that planning team are going to be critical in terms of what do we want to accomplish? And then we can go draft stuff and bring it back to you and you can comment. And then that leads into the work plan. That said, the total narrative is 15 pages. So like our whole background and approach section is going to be about 4.5 pages. Our work plan is under 4 pages. Every section has to be tight. So as we all know, it's harder to write something short that gets everything in. It's more work than writing the longer version, right? So there'll be a lot of revision.
I have a random question. I mean, I know I'm going to only be intermittently involved, but I would love to provide feedback and input as it goes, even if I'm not necessarily at the meetings. But after we have, a grant draft ready to go, I wonder about like having someone totally outside of us who is a grant writer take a look at it for us. Is that something that you guys, what do you think about that?
I think I would love that.
Yeah, I think it's a great idea.
All right, I have some.
I was wondering, Mike, do you, as the public schools, do you guys have a grant writer that would be not involved in writing this with us, but would be able to fulfill that function?
No, we don't have official people. I've got some people internally that could provide a second or third set of eyes, but if Kristen has somebody that does this, I think it's probably better to go with.
And I'm willing to ask the person just as a volunteer, not to engage in hours of free work, but if they would be willing to at least do.
It's good to have someone who's experienced with the grants look over it. It's so easy to miss something. And as Kathy said before, if your I's aren't dotted and your T's aren't crossed, you can get nixed for the silliest.
John Davio, who has advised many a coalition on this particular grant, would also be willing to review, but he would need to charge a little bit of money, not a lot. I think he told me $600, $500 for his time. So that I just throw that out. He cannot do it for free. He's no longer as involved in some of his prior projects as he once was. So, and he feels bad that he can't offer it as a volunteer, but he certainly is well experienced in this particular grant. So he may be another person we would consider if we have some money to pay him.
Yeah, I was gonna just suggest John also, just because I know his track record is really great with winning this grant. And
Yeah.
so if you can afford it, just to have somebody who, I work with several other coalitions where he and his team were the primary grant writer, and in Connecticut, not necessarily John, but Connecticut has a very strong record of winning. So there may be other people as well that I can contact within the prevention world who have had a successful track record, but John certainly has.
Yeah.
I'm very supportive. I think we should talk about, it's a short-term small investment for something that,
So John helped when we did a grant at Positive Directions. I mean, he helped, we had other people, but one in particular that I worked on, he was very helpful on, so.
Yeah.
Oh, that's great.
Well, I am going to pop off in just a moment and turn it over to you guys. But Kathy, thank you for getting us rolling on this, and thank everyone for being willing to dive in. It's really exciting. Well,
is.
remind me the due date again?
May 10th.
Oh, boy.
So-
Happy Mother's Day.
I
Yeah.
would.
Oh, yeah.
May 8th, okay, May, or 7th, that's,
Well, yeah, I
there we
would-
go.
So I'm glad you brought that up because I would like to get this in early. And there are a series of, Mike, I'm gonna just email you this separately because there are chunks of the RFA that pertain to the financial piece of this that
Sure.
involve Doreen, I would imagine.
Okay.
So I just want to be sure. And
Yeah, if we
then
need to set up a separate time with Doreen, Kathy, that's fine.
that would be great. And then there's also obviously chunks of this RFA that pertain to evaluation and performance measurement plan, having a data management plan, which basically we do already. That's just collecting the 4 core measures every 2 years, which is something that we do already. But that'll be another chunk of Emily's time that will be part of the grant writing process.
So I'm sorry to interrupt. I see Margaret put a couple things in the chat. Do we want to set, today, Thursday? Is that what day it is?
Yes.
Do we want to set up like a Thursday, 8 a.m. weekly check-in? And if it's 15 minutes, great. Do we want to do that? I mean,
Would you say Thursday?
I'm just throwing it out there. I don't even know. if
That's a better morning for me than others, so.
And it could be bi-weekly. The other thing we could do is like produce drafts for review and then just touch base and everyone goes, this is what I think, change this, that, whatever,
I think, Margaret, we should just plan, it's not that many weeks. And
Yeah,
it'd be
exactly.
confusing to do bi-weekly.
But just
and
do weekly.
If it's 15 minutes, great,
Mhm.
and we can be disciplined.
Yeah, if we can get the documents ahead of time to review prior to the meeting, that'd be great.
Mhm.
Thursday at 8.
Yep.
Thursday at 8 it is
Thursday at
on a
8 it
weekly
is.
basis.
Who will notice that? That has to be just noticed to the town clerk too.
Yep.
A series of special meetings. All right. Well, I'm going to go talk about funding for regional councils of government, and I think you all are awesome, and I'm so grateful. Thank you.
Thank
Kathy,
you all
are you-
very, very much.
Thank you. I've got to run too. I've got a 10 o'clock call.
Me too.
Kathy, are you able to stay on to talk about the bylaws for a bit?
Yes, I can.
Thank
Yes,
you.
I can. And Mike, I'm going to email you these sections that I just want you to be aware of and have
Okay,
a conversation with Doreen about.
all right, we'll set up a time, Kathy. Thank you.
Perfect. Thank you, everybody. Oh, I'm
everybody.
Guys, have a
excited. What
good
a
week.
team. We've got a great team.